I'm Jamie Camp. I'm a nurse practitioner with Goshen Heart and Vascular Center. Diabetes is a chronic progressive illness affecting 30 million Americans. It's chronic because it needs long-term management, and it's progressive because it tends to progress or get worse over time. A person that carries the diagnosis of diabetes is 2 to 4 times more likely than a person that does not to develop heart disease, vascular disease, and stroke. At the root of diabetes, the body does not create enough insulin to keep blood glucose levels low enough for the body to function normally. Over time, as those blood glucose levels or blood sugar levels go up, it creates damage to the inner linings of our blood vessels, in our heart, in our bodies, everywhere. So you have chronic inflammation over time, which decreases blood flow, but diabetes is also a metabolic syndrome and causes dyslipidemia, or an abnormal higher amount of fat and cholesterol floating in our bloodstream. So over time, those tend to deposit or get stuck together, and then they get stuck on the inner linings of our blood vessels. You combine that buildup with the already inflammation from your high glucose levels, and you start to get a lot of narrowing of those vessels. So narrowing in a blood vessel obviously creates less blood flow that can get through the vessel. Over time, those buildups on the vessel, on the blood vessel wall can actually break off. If they break off, then it completely occludes the blood vessel, and that's where you can get stroke. If they break off in the heart and includes heart vessel, you get a heart attack. So there's several risk factors for heart disease. There's diabetes, which we're speaking about. There's hypertension or high blood pressure. There's high cholesterol levels, obesity, smoking. All of those things put together put you at even higher chance of developing heart disease. So managing each one of those is really important. Goshen has a lot of resources for our community. We have diabetes educators that are available. We have dietitians that are available. We have the Goshen Center for Weight Reduction. And outside of our health system, Goshen has parks that have walking paths, biking paths, a lot of opportunities to get out and just get moving. The biggest takeaway is to work closely with your primary care provider and find out what's right for you, and to optimize the blood glucose levels through diet, through exercise, through medication if needed, and just be an advocate for yourself. If you don't know if you have diabetes and you don't know if you're at risk for that, talk to your primary care provider.